Hello, this is Josie, and I will be going over a medical report. This is at Parkland Hospital in Dallas, Texas. The medical provider is Dr. Jekyll Hyde. The patient is Grinch Uber Orton. His date of birth is 12/25/66. The date is November 19, 2016. This case history of this patient. This is a 50-year-old male who was admitted to the emergency room on November 19th in acute distress. He complained of severe pain in the hypogastric region. He complained of severe polyuria and had symptoms of bacteriuria and hematuria. He also had nocturia symptoms each night. He experienced weeks of dysuria. The patient has no past medical history. The physical examination consists of a urinalysis and a urinary endoscopy procedure. The patient's vital signs. This consists of a temperature of 100 degrees Fahrenheit, a pulse of 84. The blood pressure for this patient is 122/70. The patient has no known allergies. For the assessment, this will consist of the hypogastric region having severe pain and discomfort when urinating. Exams. This will include the urinary endoscopy and a urinalysis. The findings. Pathologic findings from the urinalysis consist of dysuria, hematuria, and proteinuria. Imaging from the urinary endoscopy of the hypogastric region demonstrated urinary tract infection. There is bacteriuria and hematuria in the urethra and ureter. The urethra region is dilated and severely inflamed. For the preoperative diagnosis, this is the urinary tract infection. The patient's general appearance appears to be average weight, 125 pounds. Average height, his lungs are normal, but as far as the abdominals, there is soreness in the lower abdomen region. For the procedure, the urinalysis, the patient is asked to clean the perineum, genital area, with a clean cloth and water up with a lid and filled to the medium line. For the urinary endoscopy, the patient is placed in supine position. The patient's then perineum genital area is washed. The patient is given a local anesthetic. A sterilized catheter-like instrument called a cystoscope is inserted into the opening of the patient's urethra. The bladder is then drained and filled with sterile water continuously throughout the procedure. The cystoscope then takes photographs inside of the urinary bladder. For the final diagnosis, this is a urinary tract infection. And for the treatment plan, Dr. Hyde prescribes the patient with a medication called Bactrim, which is an antibiotic. The patient is discharged on November 19th with a follow-up appointment scheduled with Dr. Hyde in